Have you ever had that embarrassing moment where you cough or you sneeze and suddenly you feel something in your underwear and you're like, oh no, you didn't know that something was going to happen? I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center, and I'm going to talk to you today about stress incontinence and how that's 67% of the population, which may be like 78 million women in this country, are struggling with some form of incontinence. And it's really actually fairly easy to treat, but it's also not taken very seriously by the general medical community. So a lot of people maybe don't talk about it very much, or they don't say that that is one of the issues that they struggle with. So, one of the reasons that one can develop stress incontinence, so stress incontinence, what that means is that when you sneeze or cough or have some sort of a what we call a valsalva maneuver, where your belly muscles contract suddenly, can cause you to leak a little bit of urine into your underwear. And that is caused because either your pelvic floor muscles have become weak, maybe you've delivered several babies, and when you're in perimenopause, what's happening is that the tissues in the pelvic floor become have less estrogen, and so they become more weak. And estrogen is one of the things that can be used to help support your pelvic floor muscles. Another thing that can be helpful is using Kegel exercises or pelvic floor strengthening exercises. So anything that strengthens your core or strengthens your pelvic floor, Kegel exercises, strengthening your leg muscles even will help support your pelvic floor. I'm going to talk a little bit about using estrogen. I often talk about using bioidentical estrogen. And bioidentical estrogen is what your body naturally makes when it's making estrogen. So it's not it's synthetic in the sense that it's made in a lab, but the chemical structure is the same as your body naturally makes. You can use vaginal estrogen inserts. You can use, there are little tablets available. There's an estrogen ring that you can put inside up against your cervix. There is also estrogen cream that you can use. There's also DHEA cream, which is there's a product called Jolva that is made with DHEA, and DHEA is one of the precursors for estrogen, and it's also a hormone that helps support some other functions in your body. So there are all kinds of ways to support the strength and the health of your physical tissues so that you don't have stress incontinence so much. And again, the more you do strengthening pelvic floor, strengthening exercises, the more it will help you have less you'll have less stress incontinence if you do more pelvic floor strengthening exercises. Um, Also, in Chinese medicine, so I blend Chinese and functional medicine and Western medicine so that all of these things come together to give you the ideal treatment for your situation. And in Chinese medicine, what's happening, there are two possible Chinese medical diagnoses. First of all, the kidneys. The kidneys regulate, of course, your bladder and your ability to urinate. They also regulate your low back, your knees, your bones, your physical brain, big transitions in life, which can include menopause and perimenopause, and the power of will. And the kidneys kind of hold the energy of all of the organs in place, so that the kidney's job is to help support all the other organs. And and so, of course, when you have weakness of your kidney energy, then you're going to be more likely to have weakness of your pelvic floor, which will cause you to have leakage of urine in many ways, including the stress incontinence. And the spleen is the organ that regulates your ability to take in food, the strength of your muscles, and it holds the organs in place. It does other things as well, but if for this conversation, it regulates the strength of your muscles and the ability to hold your organs in place. And so if you have like uterine prolapse or vaginal prolapse or even bladder prolapse or weakness of your bladder floor, that is all connected to spleen. The spleen is also connected to the emotion of worry and your ability to take in food. And so one of the things you can do with to strengthen your spleen, of course, is to eat really healthy foods that support your strength and chew your food really well and to just kind of not worry about things. And then also um, build the strength of your spleen. In Chinese medicine, you can use acupuncture. And I have really literally hundreds of patients that I help with stress incontinence using acupuncture and a blend of Chinese herbs, sometimes estrogen, vaginal estrogen, which all you have to do is take that about twice a week. And if you take it just twice a week, it can help support your pelvic floor without really causing you to have other estrogen issues if you're worried about having estrogen. So vaginal estrogen is one way to not take it systemically necessarily, if I said that correctly. Anyway, so there are many possible solutions and many possible ways to approach this. And if you have any questions, please feel free to reach out to me. I'm here to help you have a great life and feel amazing in your body at any age. Thank you so much.